Hello, my name is Muriel More Villamaro. I want to tell you about acute Methotrexate induced crystal nephropathy. Definition. True induced crystal nephropathy are secondary to abnormal accumulation of crystal leading to parenchymal renal urate. Methotrexate used to treat a wide range of malignancies is one of the various drugs accountable this particular condition.
Main ways that drugs damage kidneys. Some drugs decrease how much blood flows to the kidneys. Examples include NSAIDs, ACE inhibitors, and ARBs. Some drugs directly injure kidneys. Examples include penicillins, cephalosporins, contrast dyes, and aminoglycosides. Some drugs also obstruct the flow of urine from the kidneys. A common cause is calcium stones from excessive or high-dose calcium supplementation. Second, patients at higher risk may include those aged 60 or older, experiencing dehydration, with diabetes, high blood pressure, pre-existing kidney disease, heart failure, or liver failure, or having recently had surgery or a procedure that used contrast dye. Third, symptoms can occur days or months after starting a new drug. Most mild to moderate kidney injuries do not have any symptoms. People with a severe kidney injury may complain of feeling tired or confused, a sudden increase in blood pressure, a sudden change in urine output, or swollen ankles and weight gain from fluid. Fourth, the most useful lab markers are an increase in serum creatinine by at least 27 micromoles per liter in 24 hours or by 50% in 7 days, a drop in eGFR by 25%, and/or a decreased urine output. Finally, patients who experience a drug-induced kidney injury may need to have their medication doses decreased or stopped altogether.
Application in medicine. Methotrexate-induced crystal nephropathy is characterized by acute tubular injury with AYS correct intratubular and interstitial and newspaper gold brown crystal AYR frequency arranged in annular structure. The crystal hue differentiation under polarized light and are methionine silver posite.
Gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, Methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that Methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are two ways to take Methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable Methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that Methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by Methotrexate and cope with few, if any, problems. But like all drugs, Methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed Methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable Methotrexate is also proven to reduce stomach problems whilst increasing the effectiveness of the drug. As to Methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on Methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefit, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups to help answer any questions you may.
Pros and cons. Pros. Methotrexate is a infectious disease modifying and anti-rheumatic drug for rheumatoid arthritis. Cons. Methotrexate can cause liver damage, especially when taken over a long period of time. Methotrexate can cause lung damage.
Used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. In most people, methotrexate does not cause any problems. We also give a prescription for a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid, or leucovorin, is also used. Methotrexate can infrequently have some effects on the blood, like lowering white blood cells and red blood cells. Methotrexate is also metabolized in the liver. To be sure there are no problems with your liver, blood tests will need to be done, and usually this is about once a month when you first start methotrexate, and then when you're on a stable dose, this usually spreads out to about every 3 months. Minor side effects might include hair loss, which is temporary and reversible, loss of appetite, nausea or vomiting, headaches, and feeling foggy or unclear, and typically that's the day after taking the methotrexate. Sometimes mouth ulcers will occur. Most of the time these will lessen as your body gets used to the methotrexate, but if side effects continue or really become troublesome, check with your doctor or nurse. Get emergency help if you ever have any signs of an allergic reaction, like hives, difficulty breathing, swelling in your face, lips, tongue. That's very, very rare though. Methotrexate can sometimes, rarely, cause an inflammation in your lungs. If you experience a cough or shortness of breath, let your doctor know. Methotrexate is not associated with an increased risk of cancer, but it's important to recognize that people with autoimmune diseases do have a risk for cancer anyway, just because they have an autoimmune disease. There are some medications you should generally avoid with methotrexate. Trimethoprim, Bactrim, or Septra acts on some of the same pathways, and methotrexate may need to be held while you're on those medications. There is a possible interaction with anti-inflammatory drugs like ibuprofen or naproxen. However, many people with RA take those on an ongoing basis, and blood tests ensure that there's not a problem.
Use the application in Ecuador. In Ecuador, methotrexate is used by patients suffer these consequences in the body. For this reason, more studies must be done so that the patient change medication.
Crystals are urine sediments that have specific shapes under microscopy. So if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like for example, hexagonal shaped stone, it's like cysteine. Rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. the mnemonic or the way that I remember it, that calcium oxalate stones are the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cystine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. We have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember it, uric acid, sometimes gout comes into mind, and in gout, the definitive diagnosis is to get joint aspirate, okay, to see these crystals, okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid, rhomboid. So envelope, calcium oxalate. Hexagonal, cystine. Coffin shaped, struvite stones, the evil one. Rhomboid shaped, uric acid. I hope it's simple, because it is. Now it is.
Conclusion. The use in high concentration of methotrexate causes acute crystalline nephropathy. For this reason, the patient should be examined to see if he is suitable for this medicine.
I'm Dr. Tom Palella, a rheumatologist with Rheumatic Disease Center Physicians. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.